Welcome to this conference 0 to 1, and we have designed this conference in a different way, and we have taken so many lots of topics which are not discussed in any routine conference. So, for that I invite Dr. Rajesh Hydrabadi. He is a practicing cardiothoracic and vascular surgeon in Ahmedabad, and many of us knows that diabetes is treatable, but do you know diabetes is curable and reversible? So, I invite Dr. Rajesh Hydrabadi to give some insight about is the diabetes reversible or not. Thank you. Please Dr. Hydrabadi join on dais.
Hello everyone, welcome to cvccon. My first lecture is on a very $1,000,000 question, is diabetes reversible? So, from our experience of our clinical practice, let me take you on the journey of how we can reverse type 2 diabetes or how we can prevent the complications of this dreadful disease, which is caused problems for a large population in this country in this era. So, it is time to get started on thinking about diabetes as a reversible disease, not a lifelong affliction. So, there have been what we have learned during our medical practice, and subsequently there are lots of new researches which have thrown light on the cause of diabetes as well as the how to reverse it, and this is the journey on that pathway. So, dietary fat is the cause of obesity, that is what we have all been believing, and we have asked people not to eat saturated fats like butter and ghee, but the reality is that dietary carbohydrates are the cause of obesity, and that we have been consuming a lot in last 30-40 years, and we can see the epidemic proportion of patients with type 2 diabetes in our practice. So, what we suggest is, we suggest a method of intermittent fasting for the reversal of type 2 diabetes. So, one popular method of fasting which we have been doing in as a religious practice throughout our lives is to have one meal a day, we call it ekasana or ektanu in Gujarati, and for the next 23 hours we do not eat any food. So, your body exists in two states, either you are eating and storing food energy or you are fasting and burning food energy, and this concept is very important to understand, because so many people who are trying to lose weight, they keep on eating small meals every 2 or 4 hours throughout the day, and that is where they continue to store food energy and not burn their inherent food body storage of the fat. So, either you are in the fed state or you are in the fasting state, and in this case your body when you are going on a fast of 23 hours, one meal a day, you have got 23 hours to digest and burn off the sugar and fats from the previous meal, and this is very important, as we will see in reversing type 2 diabetes. So, you cannot burn fat when you eat, because your body is looking to store body fat as the food energy comes in. Whenever you eat, your body utilizes the energy that you have provided, and whatever is used for the basic basal metabolic rate, that is used up, and excess energy is stored as fat in your body. So, if you can extend your fasting period, you allow your body to spend more time burning food energy, and that is the key to the success of this program of reversing type 2 diabetes. This tidy little figure shows how quickly insulin drops in people with type 2 diabetes or insulin resistance. So, when you are not eating, when you are fasting, your serum insulin level drops very remarkably within 10 to 12 hours, and this is where the key to reversing type 2 diabetes happens. We have been taught that type 2 diabetes, where or any diabetic patient, there is sugar is plenty in the blood, but the cells are starving. So, is it really true? Actually, what happens is before the person is diagnosed as having diabetes, that means the fasting or the postprandial blood sugar is elevated. Before that, before 5, 10, 20 years, the body has been struggling with excess calories and excess carbohydrates, which is stored by a higher and higher level of insulin into all the cells of the body. The best method for insulin to store it is to increase the fat cells in the body, and that is for future use when you are not eating. But once that all the stores are saturated, then the blood sugar, which cannot be stored in any of the cells, that spills into the blood, and that shows as a high blood sugar, and that is what we call diabetes mellitus. But there is a long period of 5, 10, 20 years where the process of storing these excess calories has been going on, and that needs to be emptied before we can even think about reversing type 2 diabetes. So, there are two phases of type 2 diabetes as shown very clearly in this slide. There may be 14 or about 10 to 15 years when the blood sugar remains quite stable, but the patient is developing insulin resistance because he needs higher and higher amount of insulin secreted by his internal pancreas to maintain his blood sugar normal. And once he crosses that threshold, then it shoots up and presents into the blood as a hyperglycemia. So, the key to type 2 diabetes is insulin resistance by the tissues, which does not allow insulin to store any more sugar in the cells, and that is where it manifests itself as the pathological and clinical feature of diabetes mellitus. So, now we have been taught all this time, we have been thinking all this time that let us count the calories. If my basal metabolic rate is say 2000 calories, if I eat only 1500 calories a day for next 6 months, I will lose weight. So, that has been the secret of all the weight loss parameters that are programs that are going on in the society. For the short term, yes, any of these dietary programs is going to help you to lose some weight, but for the long term, it is the hormonal system. You have to target your levels of serum insulin and the other hormones, which will help you in reducing weight, maintain your health and remain healthy for the long term. Eat less, move more. We always tell our patients, you need to eat less and you need to do more exercises. That is the way to health and weight loss. Calorie in, calorie out is not proven to be effective in solving the problems of metabolic syndrome. So, before the patient develops type 2 clinical type 2 diabetes, he is developing obesity, truncal obesity, he is developing hypertension, he is developing various inflammations. These are the signs of metabolic syndrome as we know it, and if we can catch the patient at that level and we can help him to reverse his metabolic syndrome status, he may never develop type 2 diabetes. So, these are the theories what we have been practicing so far. We have always been thinking of calorie in, calorie out as the large circle. The endocrine system has been ignored up till now because we do not measure them, we do not realize that this is the cause, and that is where there is the truth lies in the convergence of between these two theories. So, as we all know, type 2 diabetes is a disease of blood sugar elevation. Diabetes is a disease of, but the truth is diabetes is a disease of insulin resistance, which starts decades before blood sugar increases. The commonest method in a clinic or even at home, what you want to do is to check your waist to height ratio. If it is more than 0.5, you are on the pathway to developing insulin resistance and type 2 diabetes in the future. So, waist circumference and insulin resistance are very strongly correlated, because once the insulin is elevated because of the resistance, it tends to store the fat as visceral fat in the around the viscera in the abdomen, liver, pancreas as well as the mesentery, and that is where the waist circumference goes up. You can, a person who is diagnosed as diabetes, if he looks at his own photographs maybe before 10 years or 15 years or when he got married, he or she, then you will realize how much of the waist circumference has increased in the preceding 10 years, and that is the cause of their problem right now. Now, let us go to what is the why we need to reverse type 2 diabetes. because atherosclerosis is the biggest problem which is creating problems in the society. A large number of people we have been treating with are presenting with atherosclerosis. Actually, your biological age, your chronological age may be whatever, but it is the health of your blood vessels that determine how old you are. So, a person may be 50 years old, but if his blood vessels are 70 years old, he is likely to have a problem, and this is where we come in with how to determine the vascular health of a person. And again, insulin resistance and type 2 diabetes has a great role to play in the pathogenesis of atherosclerosis. Serum ferritin level is a big marker which we should all know about. We never get it done for our patients, but it has good predictive values. Another very important thing to say is to detect your plaques earlier. I very strongly recommend anybody who is above the age of 40 and below the age of 65 with no clinical problems at all to undergo a coronary calcium scan, and that gives you prediction as the next slide shows. If your coronary calcium scan is 0, there is a very low chance of you having any cardiac problem in next 10 or 15 years. But if the coronary calcium scan is positive, then you are at a higher risk. The risk is incremental as the score increases, and this can be reversed. So, let us come to the various causes of obesity as we understand now and what actually they are. Do carbohydrates alone cause obesity? No. Does fat in the diet cause obesity? No. Does calories alone cause obesity? No. It is the frequent carbs plus fat combination which causes insulin resistance and storage of fat in the body, and which is eventually producing the problem of metabolic syndrome and type 2 diabetes. So, why are we advising patients not to have sugar? Sugar is the only substance that humans ingest that has no nutritional value whatever, no essential fat, no essential proteins, no vitamins, no minerals. So, sugar is something which is non-essential as far as our diet is concerned, and it can be prevented, it can be avoided totally from our diet. Now, some of us advise, if I do more exercise, I will burn off my fat and get rid of my disease. But just imagine, if you are a say 70 kg average person, you walk 45 minutes, you hardly burn 102 calories. But if you do not eat food for one day, you can burn 2000 calories, and that is a biggest reward of this method of intermittent fasting, which is used to reverse your type 2 diabetes. This is a very busy slide, but then we have to look at it because metabolic syndrome is the whole spectrum of diseases which we do not consider as related to this are all mentioned in this liver: fatty liver, PCOD, type 2 diabetes and complications, high triglycerides and low HDL, dementia and Alzheimer in the old people. Some malignancies are caused by obesity and type 2 diabetes, coronary artery disease, high blood pressure, weight gain and truncal obesity. So, what is the purpose of this webcast? We want to tell you that much of modern life is preventable chronic stress injury. Remember, it does not happen overnight that I was non-diabetic and I become diabetic within 24 hours. It is a very long process of chronic stress injury to my body, which I have not known about and I have ignored. So, if you eat food, the pancreas will secrete insulin to digest that and store sugar in the liver and produces fat in the liver if the sugar is not needed at that particular time. If you do not eat food, that is you are fasting, it reduces insulin, the stored fat and the carbohydrates in the liver are burned to maintain your metabolism, and that is what is the key. So, there is a sort of lock and key paradigm we have been told that the cells are starving of sugar when you are type 2 diabetes, and that is why you have to continue to eat carbohydrates and take medicines or insulin, so that the cells can function normally. But that has been a wrongly proven theory, because actually the cells are overloaded with carbohydrates, and once they are fully saturated, only then the excess sugar drops down into the blood and that manifests itself. So, first we have to get rid of all the excess stored carbohydrates in the cells, which we never measure in the laboratory, and for that we have to just allow the body to utilize that stored carbohydrates, so that there is a place for whatever next time we eat a meal, the cells can be replenished. So, insulin resistance is an overflow phenomenon, and not, there is no cellular starvation going on. So, just like this, there are in the Japan, when the trains are full, they have employed people to push some more passenger inside the compartment. Same way, whenever our body cells are full of carbohydrates, they refuse to accept more glucose, and insulin tries to push more inside. So, what causes fatty liver? We all know, we are about 1/4 of the population is having fatty liver, and they do not even know about it. So, what causes fatty liver and non-alcoholic fatty liver disease is fattening carbohydrates and high insulin leads to obesity, and that leads to fatty liver and insulin resistance syndrome. So, glucose plus fructose, that is sugar. Sugar contains 50% glucose and 50% fructose. That causes fatty liver, because when the fructose can only be metabolized by liver, it cannot be utilized by any of the cells of the body. So, that goes to the liver decides, okay, right now you do not need these carbohydrates for the metabolism of the body, and the best way for it is to store it as a fat in its own tissues, so that it can be utilized in future when there is no food available. So, actually what happens when you are type 2 diabetes, when you are measuring your blood sugar, which is 150 or 200 or 300, it is your body is overflowing with sugar, and that sugar ball is full, and you are still pouring in more and more carbohydrates, and that is what is the whole problem. So, in a normal cell, glucose is there. What we have been taught is, when the patient is diabetic, there is internal starvation in the cells, but actually there is the one on the right side, actually there is plenty of glucose within the cells, and that is why the patient is developing type 2 diabetes. So, how to reverse type 2 diabetes? So, type 2 diabetes is too much sugar in the body. So, treatment is, do not put more sugar in the body, just go for a low carbohydrate diet, or allow it to burn off the excess sugar, and it will come back to normal state again. Body is capable of doing that, but that you have to do intermittent fasting, whether you do 16/8 fasting, alternate day fasting, once in a week fasting, or 7 or 8 days fasting in a Navratri, or maybe Ramadan you do 1 month's fasting, that whatever is, that is your choice, right. Now, this is a slide by American Diabetes Association. Fact, for most people type 2 diabetes is a progressive disease. Eventually, oral medications may not be enough to keep blood sugar level normal. Using insulin to get blood sugars to a healthy level is a good thing, not a bad one. But can we cure type 2 diabetes? Yes, we can. So, if you do not have diabetes, there is no diabetic neuropathy, nephropathy, no diabetic foot complications, no diabetic retinopathy, the chances of CV stroke are reduced, chances of myocardial infarction are reduced, and incidence of cancer also goes down in that population. So, no drugs, no surgery, no cost, and that is the key to this method of reversing type 2 diabetes. Now, let us examine the scientific evidence. When we talk about intermittent fasting as a capacity to reverse type 2 diabetes, we have a very good source in the bariatric surgery. So, we have seen, we all know that gastric banding reverses type 2 diabetes within a month or two in any patient who has undergone bariatric surgery. Surgery does cure diabetes. So, how does it do it? By not allowing the person to eat as much as he was before the surgery, and that is the key. So, if I do not eat without surgery, if I go on a fast, I am having the same effect as a gastric banding or a bariatric surgery without any surgery. I save money, I save the complications of all the surgical procedure, and I do not spend any money. So, the key to this whole thing is that insulin is an anabolic hormone. Its function is to collect all the energy that comes into the body via food and store it as a fat or muscle in the body. Now, high insulin level will not allow the body to burn the fat which is stored in the body. So, insulin inhibits lipolysis. The moment insulin level goes down, the body starts eating the fat that it has stored, and that is the way to go. Now, this slide shows that if I have not eaten anything for say 10 hours, just look at the amount of fatty acid increase at around 11 hours after fasting, after I have stopped eating, and that is where the fat burning mechanism of the body starts. So, minimum you have to fast is for 10 to 12 hours a day. So, fasting versus bariatric surgery, again a comparative chart is there. So, exactly the same thing which I have been telling right now, that they are comparable, and only thing is in fasting you do not undergo any surgery. This is a quote by Mahatma Gandhi: speed is irrelevant if you are going in the wrong direction, because you will eventually keep on going in the wrong direction. So, the point is we need to take a U-turn from what we have been doing for last 20-30 years and get back to your previous healthy self which was there before 10 years, when you are not diabetic, not obese, not having any hypertension and not having any complication. When you change the way you look at things, the things you look at change. So, here again we have always been thinking of eating less, remaining a little hungry, go little this, but that has not been helping us. The key to weight loss is diet quality, not quantity. When diet is wrong, medicine is of no use, and when diet is correct, medicine of no need. This is an old Ayurvedic proverb. Anybody who is more interested in finding out about the various mechanisms, Dr. Jason Fung is a nephrologist based in Canada, and he has written a nice good books about this, as well as plenty of blogs and videos are available on the internet. You can follow it through. So, ignorant man raised questions that wise men answered 1000 years ago. Fasting has been in our culture, in our religion for thousands of years, and there was a purpose behind it. The wise men who had advised people to fast once in a while, they knew actually what they were doing, and they just put it collected together with religion, so that people do not ask questions, they just follow it blindly, but they were wise people. So, this is the what happens in our body when you eat. The green line, that is where the insulin level goes up, and we are not eating, that is the blue line where the insulin level goes down and the body starts using the fat that it has stored. Now, unfortunately, if that green lines are 1, 2, 3, 4, 5, the insulin does not get a chance to burn the fat, and that is what we have all been doing. But we only do not eat while we are sleeping. If we can increase that period of not eating even part of the day, maybe 8 hours during awake time, 8 hours during sleeping time, then that much body fat will be burnt to maintain the metabolism. So, shed the belly fat, it is a predictor of heart disease, diabetes and certain cancers. Visceral fat is linked to many types of inflammation like plantar fasciitis and tenosynovitis or cervical spondylosis also. The biggest advantage of this method of regaining your health is known as fasting and feasting. So, there is no such thing as eating too much. only eating again too soon. If you can maintain your health very nicely with one meal a day, why do you want to eat twice a day or maybe even 3 times a day? So, that is the key to this. Now, I will go to some clinical scenarios where we can help these patients. A young girl, woman wants to lose weight fast before a coming wedding or function. If she practices this method of intermittent fasting, she can gain her desired weight within a short period of time. Infertility, inability to conceive, obesity and PCOD in a teenage girl, this can be reversed with this methodology of intermittent fasting. Young obese pre-diabetic man, woman with waist height ratio of more than 5 needs to reverse his obesity, so that he never becomes diabetic and never has the complications or the problems associated with that. A diabetic patient with controlled by oral medicines known as type 2 wants to get rid of his medicines. So, there again this method of intermittent fasting and taking control of your health can help you to cure this disease. A hypertensive wants to get rid of medicines, again this same methodology can help that person. Insulin dependent type 2 diabetes, this is a tricky situation where we first needs to know whether the person's pancreas is secreting enough insulin or not. So, for that we check the C peptide level of the patient in a fasting state. If that is normal, that means he does not need any exogenous insulin and he can easily get rid of that and be controlled with oral medicines. And patients with cancer as a supplement to treatment, patients with malignancy, if they go on an intermittent fast, they trigger something known as autophagy, and that gets rid of all the damaged cells in the body, and that helps in the longevity of a cancer patient, along with the surgery, radiotherapy and chemotherapy that the patient is undergoing. Thank you.